just in general, we're going to start by just briefly reviewing some benign gynecologic conditions that we can address using the robot. Wrong way. Briefly discuss the symptoms of those conditions, some of the current treatments and surgical options that are available, and how we can apply robotic technology to these same surgeries, particularly using the robot for hysterectomy and a procedure called myomectomy, which we'll talk a little bit about. So just very brief overview of the organ system that we're looking at. The main reproductive organ in the female is the uterus, or the womb, which has two layers. The inner lining, which is the endometrium, that's where a pregnancy would grow. And then the main thickness of the uterus is called the myometrium, that's made of muscle tissue. And attaching to that, we have the fallopian tubes, which connect to the ovaries. And at the bottom of the uterus, the opening of the uterus is a cervix, which connects to the vagina. So some of the conditions I'll be touching on today include fibroids, tumors of the uterus, pelvic masses, other tumors that can occur within the reproductive system, conditions that can cause abnormal bleeding, as well as a condition known as endometriosis. So what exactly are fibroids of the uterus? Well, fibroids of the uterus are very, very common. In fact, it's not a stretch to say that everyone in this room probably knows somebody who has experienced fibroids of the uterus. In fact, they estimate that anywhere between 40 and 60% of women have fibroid tumors in their uterus. It's just that most of the time they don't cause any symptoms or problems, so most people aren't even aware that they're there. They're almost always benign tumors. The chance of a fibroid tumor being malignant is less than 1 in 10,000, so it's something we almost never see. And they can vary by the size and the location. They can be as small as the size of a pea, and we've seen them as big as the size of a honeydew melon or even a watermelon sometimes, very large. So, in terms of location, they can either be what we call submucosal, growing inside the cavity of the uterus, intramural, which is in the thick wall of the uterus, or subserosal, which is hanging on the outside of the uterus. Sometimes they don't cause any symptoms at all, but often they can cause severe bleeding. They can cause issues with fertility, especially if they're creating problems within the cavity of the uterus where a pregnancy is supposed to grow. When they get large and push on the bladder or on the intestines, they can cause problems with urinary frequency or constipation. And they can also cause a lot of pressure or pain in the abdominal area just because of their sheer size. So current treatment option for fibroids, of course, there's conservative management, which means just absolutely doing nothing. If they were discovered, either someone felt them on an exam or you had, say, for example, an MRI because you had a hip injury and they happened to see these. If you're not having any pain or bleeding or any other symptoms, most of the time you can leave them alone. There's no reason to have surgery just because you're seeing them there. When they do cause symptoms, we do have a few treatment options. There's a couple of ways of just shrinking the fibroids rather than completely eliminating them. There are medications which can do this. The downside of these medications is that they do induce menopause. Now, it's temporary while you're on the medications, but you can imagine what all the side effects of those medications would be. And then there's also a procedure that's very popular and very effective called uterine artery embolization. This is a procedure performed by radiologists where they inject little microscopic beads into the blood vessels that go into the fibroids, and they actually stop the blood flow to the fibroid, so the fibroid starts shrinking because of that. But sometimes we need something a little bit more definitive that doesn't have a chance of the fibroids coming back, or we need to remove the fibroids completely. And the two surgeries for that are a procedure called myomectomy, which is where you remove the individual fibroid tumors themselves but leave the rest of the uterus intact. This procedure is ideal if you want to preserve the actual uterus, if you have a patient who does not want their uterus removed, they just want the tumors removed, or if you have someone who wants to maintain their future fertility, they haven't completed their childbearing yet. And then, of course, the most definitive option is a hysterectomy, which would be removal of the entire uterus. Not necessarily the ovaries, it could just be the uterus with or without the ovaries. There's also a condition called endometriosis, which is extremely common. This is when that lining of the uterus, the tissue that's normally supposed to be in the lining of the uterus, starts growing in areas outside of the uterus. This can cause very severe pain, either during your periods or between your periods. It can cause chronic pain, which is just ongoing daily, regardless of when in your cycle you are. It can could cause very painful bowel movements, especially if the endometriosis is growing behind the uterus and close to where the rectum is. It can cause pain during and after intercourse, depending on the location. It can also cause extensive infertility issues, number one, because it can damage the ovaries, and number two, we don't really know why yet, but it does cause some alteration in the hormones and release some chemicals in that area, which can also impact your fertility. And it can also cause irregular vaginal bleeding or irregular periods. Current treatments, sometimes you just want to manage the pain if that's the primary concern. The treatments available for that are oral contraceptive or birth control pills or just regular pain medications. There's also more extensive medical therapy, such as the medication I alluded to earlier with fibroids, which induces menopause. And then there's also surgical options, which is more effective than the medical options. And that includes resecting the areas that have the endometriosis on them. Procedures known as ablation, where you use different technologies such as heat or laser to actually destroy the endometriosis tissue. And then the most drastic in situations where none of these other treatments have worked, or if someone just wants something completely definitive without any risk of the condition coming back, is hysterectomy in some cases. So in terms of hysterectomy, what are we looking at? Right now, aside from cesarean section, it's actually the most common female surgery performed in this country. And that's because it really is the definitive solution for men or uterine conditions. Now, part of the reason it is so common is that up until now, it really was the only treatment option available. And now we do have a lot of other conservative treatments that can spare you from having a hysterectomy and can effectively treat a lot of conditions, but in a lot of cases, a hysterectomy still is the most ideal choice. There's about 600,000 of these procedures performed annually, and most of these, and I'll show you a slide next to highlight this, are performed through an open abdominal incision, which is either an up and down or a horizontal incision in the lower abdominal area. But the exciting thing is that we're getting a lot more advances in minimally invasive techniques for performing a hysterectomy, and more gynecologic surgeons are performing minimally invasive surgeries in order to perform hysterectomies. Myomectomy is also an extremely common operation, not nearly as extensive as hysterectomy, but still very common. About 40,000 of these are performed annually in the United States, and again, most of them are through open abdominal incisions. If you have a lot of fibroids, if they're very extensive or extremely large that they do so much damage to the uterus that it's not salvageable, unfortunately, sometimes hysterectomy is needed. But because of advances in minimally invasive surgery for myomectomy, we're finding more and more that we can perform myomectomy when it really wasn't an option before because it was too difficult of a surgery with some of the older techniques that we had. So as I mentioned before, in terms of approaching a hysterectomy, there's a few different ways of doing it. The most common way is from an open abdominal incision, either up and down or horizontal. But in terms of less invasive ways of doing a hysterectomy, there's vaginal surgery where we actually approach the uterus through the vagina and can move it that way, so there's no incisions on the skin. Conventional laparoscopic surgery, which you've heard a little bit about tonight, and I'll go into more detail, as well as robotic-assisted hysterectomy. So what are we looking at in terms of the way hysterectomy is performed right now in the United States? Well, about 2/3 of hysterectomies are still being performed with open abdominal surgery. And this is not because they need to be done with open abdominal surgery, it's just because minimally invasive techniques are still being adopted, so not all surgeons know how to do them and not all centers have the equipment to do them. So because of that, we're still seeing a lot of hysterectomies being done open. 25% are done vaginally, and even with all these technological advancements, a vaginal hysterectomy is still an excellent option in certain limited cases. But the thing that is a little bit disturbing for me, but also exciting in the sense that we have an opportunity to really change this, right now only 9% of hysterectomies are being done laparoscopically and only 4% robotically. So while it's discouraging that so few women are getting this option, it is exciting that we really do have an opportunity here to really expand this technology to more and more women so that we can really cut down on this number. And I'll go into all the benefits of that.